I'm Jose Trani, and I'm a vascular surgeon with Swedish Heart and Vascular Institute. Everyone in the vascular group here at Swedish Medical Center is board certified, and what that means is that we've spent extra time training and working specifically in the field of vascular surgery. That's all we do, as opposed to some other surgeons who might take out a thyroid one day and do a colon resection the next day and then perform a leg bypass the day after that. We've taken all the other areas of surgery off the board and are just working in the field of vascular surgery. And I think that's important because, as everyone knows, the field of medicine has continued to expand, and the amount of things that you need to know, understand, and the nuance of all the procedures are really very intricate. And I think that to become a specialist and to have the level of expertise needed to provide the patients with best care requires sole commitment and focus to one particular aspect of the field of surgery. When I first see patients, my thoughts go towards trying to identify what that patient and that family values. What's their functional status? What do they hope to attain from our interaction? What sorts of things have influenced their decision-making in the past with regards to medicine and medical decision-making? I think one of the biggest changes in medicine probably over the past 20 years is the attitude shift of the physician. I think that the 80s and 90s attitude was very much you went in to see the physician, they told you what to do, and you went out and did it. Nowadays, with the dissemination of information, with a lot of patients really having an understanding of their medical problems, and with a lot of them not having that level of sophistication, your job is to bring everybody to the same level. And your job isn't necessarily to tell people what to do, but to provide them with information and potential solutions to whatever problem they have that they brought to your clinic. So there were probably two major things that pushed me to selecting Swedish as my home to practice vascular surgery in Seattle. The first was the name and reputation of the healthcare system. If you want to practice at the highest level, you go to the best hospital around. The other reason was the fact that vascular is housed inside of the Heart and Vascular Center. And having been through 4 or 5 different healthcare centers during my training and in my professional career, I have not seen a healthcare center that has actually been able to achieve a combined heart and vascular center in the way that they do at Swedish. And by that I mean the cardiac surgeons, the cardiologists, and the vascular surgeons all have areas of overlap. And in most of these institutions, when there are areas of overlap, that means that you are fighting for control of those patients. And that just doesn't happen here. The whole idea of the Heart and Vascular Center is to provide collaborative care to give the patients the best experience and the best outcome, and that truly happens at this institution.